value is more than just a great price. That's why this segment is brought to you by Pick n Pay.
Lots more indeed, Katlego. Nou, vanoggend is ek weer eens die espresso proof konyn, and we are talking medical screening tests and why it is important to get them done regularly. Now, over the next couple of weeks, we will be doing a couple or series of tests live here on Expresso, and we're going to be starting this morning with a cholesterol and glucose test. Now, here to tell us a bit more about it, we have Franza Katz, the regional manager of PnP Pharmacies, and also clinic sister Marlene Seaford, who's going to be performing the actual test. You see how I got nervous there when I said your name? I remember that injection you gave me the other week. Morning, thank you for joining us this morning. So we're talking medical screening tests, Francois. Yes. What exactly does a medical screening test entail, and why is it important to get them done, kind of regularly?
Medical screening tests involves blood pressure, blood glucose testing, cholesterol testing. We also take the weight and height to work out the body mass index. And from those tests, we can say to the patient, look, you're absolutely healthy, or no, your sugar's a bit too high, and we can refer them to the doctor to do a full, more in-depth test. And the reason why we do the screening, or why we would advise patients to come regularly, at least once a year, is they are called the silent killers. You can walk around with high blood pressure, high blood sugar, high cholesterol, have no symptoms, and think you're absolutely fine. Meantime, it's causing organ damage. And it's damaging your body, and you're not aware of it. So by popping in for a 20-minute, takes about 20 minutes.
So it's fairly quick.
Have a screening done, and at least you can then see, hang on, I'm fine for the next 6 months to a year, or no, let me rather go see my doctor. There might be something there that we can fix before it gets worse.
Now, Sister Marlene, you're going to be testing my glucose and cholesterol levels this morning. Tell me a bit about the test and how does it work?
The test is just a finger prick. It's a screening that we do. If it's raised above normal, then we refer you back to your doctor.
So what is the normal levels that we're talking about?
Normal levels for glucose is between 4 and 7. And for cholesterol, we wanted 5 and under.
Okay, so I think let's get this test underway quickly.
Have you eaten anything this morning?
Early this morning, at around 3:15.
Because it also depends. Oh, that's early. Okay, because it also depends, obviously, if you've just had a meal, it would differ. So we normally would ask patients to have a fasting test, get a better result.
So it's a good thing that I didn't eat now often.
Absolutely.
All right.
You weren't in the kitchen there eating with them.
No, luckily not. So do you need to be a certain age to do these tests, or what would you prefer?
Not really, but the World Health Organization recommends from the age of 18 that you should go once a year, or maybe every 2 years, and just have a screening done and check that you're healthy.
And these tests can be done by any Pick n Pay pharmacy?
At the clinic, yeah. Our clinic sisters do it. So you can go into any Pick n Pay pharmacy, and the nursing sister can do the screening for you. There are also medical aids that pay for it now.
Yes, that's what I wanted to ask you.
Yeah, more and more medical aids are paying for it because they feel it's much better to prevent the illness than getting to the point where the patient is diabetic and he's got to take a whole lot of medication, or high blood pressure medication, whatever. So it's preventative instead of trying to help the patient afterwards, which can cost a lot of money. Are you sorted there?
Yeah,
so what's happening here?
The monitor is giving you a hard time.
Is the monitor giving you a hard time?
Probably.
I don't know, should I be relieved? Right, okay, so sister, while you're figuring that out, cholesterol and glucose in your system, what exactly does it mean, for your body? What is that? What is it?
High cholesterol, I think while she figures the machine out, I'll answer that. High cholesterol, you get good cholesterol and bad cholesterol. There are 2 types. But what it ultimately would do is if your bad cholesterol is too high, it would cause fatty deposits in your arteries, which can clog up the arteries.
Okay, here we go. Does it hurt? Does it hurt?
No, it doesn't hurt.
Oh, it doesn't hurt at all. It's like a little shock.
So you don't want your arteries clogged up. And also with high sugar levels, it's going to cause kidney damage eventually. There's a lot of things that can happen if they're out of kilt.
So it's extremely important to get these tests.
Oh yes, it is.
Okay, and how long does this result take to come out, can I say?
Immediately.
30
seconds.
30 seconds. Okay, let's check this out.
Enough blood there?
Enough blood. I'm being robbed this morning.
There, you can just hold that.
Cool, got that. Okay, so quickly it comes through.
6.7.
Okay, which
That's
means
your glucose, which is normal.
normal.
Glucose
Anything
is
between
spot on.
4 and 7 is fine.
All right, and the cholesterol we're still waiting
It takes
for.
3 minutes.
It takes 3 minutes. All right, so we'll find that out later, guys. Thank you so much for joining us. And we'll see you guys next week again for the blood pressure test.
Do the blood pressure and we'll give you the result of the cholesterol.
Fantastic. Can't wait for that. Right now, over to the
Thank
kitchen
you.
with Liesl and Kia to make some leftovers.